Thank you for joining us for this next session. We do have two presenters, though one is here already, and hopefully our second presenter will come shortly. So the first one we have is Amy Meister. And Amy, if you want to introduce yourself a bit, and then whenever you're ready, you can share your screen and start your presentation. Oh, and we see the second presenter. And Tim, I'll announce you when it's your turn to present, if that's okay. Okay, go ahead, Amy.
Perfect, thank you.
Hi, my name's Amy. I'm a Master's of Science in Nursing student here at Dal. So I'm just going to share my screen. Okay. That's sharing my whole thing and my script, isn't it? There we go. Can everyone see that?
Yes.
Okay,
Yeah.
perfect. All right, so today I'm going to be presenting on a scoping review entitled Supporting Primary Care Providers Working with People Living with Dementia, Understanding Existing Tools and Their Implementation. So I'll begin with the research purpose in question, and then I'll give some background on the topic, and I'll talk about the methodology and findings, and then I'll open the floor to any questions. So the purpose of this research was to summarize and disseminate data about available interventions and how they were implemented into primary care settings. And our research question is, what is known about how to implement evidence-based interventions in primary care to support healthcare professionals in caring for people living with dementia? So give a little bit of background. Dementia is a diagnosis seen across healthcare settings, from long-term care to acute care, and everywhere in between. As of 2020, there are about 597,000 people living with dementia in Canada, and this number is estimated to increase by 65% by 2030 to 990,000 people. And in Canada, only 41% of primary care physicians feel competent to care for people living with dementia, which further highlights the need for healthcare providers to have access to dementia-specific interventions and information on how to implement these interventions to aid in improving the quality of life of people living with dementia. We chose primary care as a setting for the scoping review because it's well positioned to support people living with dementia in Canada for various reasons. First is continuity of care. So GPs tend to see people across the lifespan, and they may be able to pick up on small changes in behavior and memory. And people often trust their GPs and have good rapport with them, so they feel comfortable discussing topics like dementia. Gateway to healthcare. So primary care is typically the first, they're the first healthcare providers that people living with dementia see when they have a health issue. So interventions targeting this setting could help mitigate some healthcare issues that patients having to reduce the burden on the rest of the healthcare system. So for our scoping review methodology, we used the Arksy-O'Malley procedure. So our population was primary care healthcare professionals. Our concept was successfully implemented evidence-based non-pharmacological dementia care interventions. And the context was primary care clinics. So these are all the databases we searched. And the original search, we included gray literature, and it was a very broad question, and we got about 7,900 articles, which was a lot. So then after the title and abstract screening, we got it down to 144, but that was still too many to effectively analyze, especially for a scoping review. So we narrowed the search down again, and we got 40 articles, which was much more reasonable. So characteristics of the included sources, they were all peer-reviewed articles. They were published between 2002 and 2022, and the most common places of publication were Canada, US, England, and the Netherlands. So now I just have an overview of the different types of interventions that we saw in the scoping review that people implemented in primary care. So for education-based, we have toolboxes for primary healthcare workers, and these were like quick access information cards for GPs and healthcare workers, or toolboxes on practical tools and tips for communicating with people living with dementia. Another education-based intervention was advanced care planning. So these aim to improve the knowledge, confidence, and to also empower GPs working with people living with dementia when it came to these advanced care planning conversations. Resources for learning about dementia. So a lot of these were online-based courses for healthcare professionals to increase their competency on dementia as a disease. Shared decision making. So a lot of these were like online educations on this topic, what it is, how to utilize it, and the benefits of shared decision making. And last one was gaining knowledge in community resources. So they were both online and in-person types of interventions for that. And technology-based, we have online care pathways. So these are software programs that physicians or nurses would input some symptoms in, and the software would generate evidence-based interventions, help in managing medication, and it would also offer community-based referrals for these patients. Another was interprofessional communication software. So this allowed the healthcare professionals communicate effectively with each other relating to the care of the person living with dementia. We had a couple models of care. So a rural healthcare model was implemented to improve the access of care for people living with dementia in rural settings by giving healthcare workers tools and education on team-based care, available supports, and assessment tools. And then case management. So in general, case management is the coordination of care for people living with dementia. So what this encompasses is identifying needs of people living with dementia and their support person, identifying what people should be assessed for dementia, doing chart reviews to identify gaps in services, and connecting with these appropriate resources, and also collaboration between the healthcare workers. And these case managers are typically nurses or social workers. And I just put shared decision making in the model of care because it's also a model of care as well as the healthcare professionals were learning about it, but it was also a model of care. So from the papers we reviewed, we documented the barriers and facilitators that either leveraged or hindered the implementation of these interventions into the primary care setting. And then we mapped them onto the different CFER domains. And this is the older version of CFER. So I just kind of laid them out here. I'll quickly go over them. So in terms of the barriers, we have the innovation domain. So the two that we saw were complexity. So if the intervention was not user-friendly or if it increased the workload to the healthcare professional, it was a barrier to implementation. Also cost. So a high cost of implementation was a barrier. And an example of this was one of the online care pathways. It was just expensive to implement that into practice. In odor setting, we have external policies. So this was seen by challenges in reimbursement for implementing an intervention. So there was one intervention that focused on bringing primary care to community dwelling individuals, and there's issues in reimbursing the physicians for this, so that was a barrier. In inner setting, we have available resources. So if there's a lack of time or personnel to accommodate and implement the intervention, it's a barrier. And implementation climate. So in one instance, there's lack of support for a new case manager in navigating their role, and that was a barrier to implementing that intervention. In terms of implementation processes domain, we have reflection and evaluation. So there's lack of studies evaluating implementation, and this was actually a theme seen across the scoping review. I can't think of one article that actually included a process evaluation from the intervention implementation. Then we have individuals' domains, so knowledge and beliefs about the intervention. If healthcare professionals lack knowledge about the intervention, it made it hard for them to implement it. And individual stage of change. So if there's resistance to the change or resistance to change from the healthcare professional, they were more likely not to implement the intervention. And then we have facilitators. So in terms of innovation domain, we have relative advantage. So in one intervention, It really promoted the autonomy of people living with dementia, which was considered advantageous to healthcare providers when compared to the alternative, which was not promoting autonomy. So that facilitated implementation. Adaptability of the intervention. So if it was able to adapt to fit the current context of implementation. In terms of odor setting, we have patient needs and resources again, but this is an online educational resource was actually informed by needs assessment and stakeholders, and that promoted implementation. Cosmopolitan, so when the intervention collaborated with outside agencies like the Alzheimer's Association, it facilitated implementation. In terms of intersetting domain, we have culture. So in one of the advanced care planning interventions, interprofessional collaboration encouraged implementation. In leadership engagement, we have supportive leadership, of course, encouraged participation and implementation. In terms of implementation processes domain, we have engagement. So some interventions included input from partners and other stakeholders, and this really facilitated implementation. Individuals domain, we have knowledge and beliefs about the intervention again, but this is a strong knowledge base about dementia and the available services, improved implementation of a certain case management intervention. Okay, so now I want to connect the scoping review to future research. So I'll talk about the Flipping Stigma Toolkit. So this tool was created to challenge the stigma associated with people living with dementia and how to appropriately respond to it. It was created by an action group, which contained people living with dementia, researchers, and students. And I know about it because my supervisor, Dr. Moody, is on the team as well. And it includes tips for healthcare professionals that care for people living with dementia, like talking to the person, not the caregiver, and listening and believing the patient's concerns. There's also education on recognizing and responding to stigma and discrimination. Sorry, just one sec. Okay. And there's also resources that were useful to people living with dementia and healthcare professionals, and additional education on how to create advocacy and action groups. And the goal of this toolkit is to implement it into primary care. So we are going to take the recommendations and background for implementing interventions into primary care and use it to implement or facilitate implementation of the Flipping Stigma Toolkit. Stop sharing. Okay. And that was any questions? I kind of went through that kind of fast.
Great. Thank you so much, Amy. That was a very nice presentation. Is part of this to be for your thesis? Are you like carving out a piece out of this? No.
This was done actually. The search was done, I think, in 2023, so it's a little bit older, and we haven't published it, so we're just trying to disseminate it this way. But no, it's not for my thesis.
No. Okay.
But it was
Just
part
curious.
of your undergraduate research project.
Yes, it was for my independent study.
Okay. All right. No, that's just nice. It's nice to see that. So
Yeah.
Anyway, any questions for Amy? It is a great skill to learn how to do a scoping review. So I think you'll benefit for that for years to come. So that's wonderful. You were able to be part of that.
Yeah, we definitely learned a lot, and I learned a lot about how to conduct this type of research.
Yeah, good.
Amy, do you want to say a little bit more about your undergraduate project and what you did for this?
Oh, yeah. So I did this for my independent study, so it was used for one of my courses during my undergraduate nursing degree here, and I don't know, it was a lot. So I was on a team that like did the scoping review, and there's a couple other projects associated with it. And basically I just did all, or not did all the work, but I've worked, and we brought this scoping review together, and I presented it at a couple different conferences. And I also got funding to do this research by the Alzheimer's Society of Nova Scotia. So they gave me the Abe Leventhal Undergraduate Student Research Award towards this scoping review. So I presented it at their annual general meeting as well. And I think it was really good. And it contributes a lot to implementing these interventions in primary care, which is, I think we'll see more of as the healthcare system's so burdened. Our primary care physicians and healthcare workers are going to be doing more and have more responsibility in that.
And the other piece is you got a Faculty of Health undergraduate
Summer
research award.
I got the faculty.
Amy's done a lot of work.
You're such a
on this
supervisor,
project, so I just wanted to make sure
Yeah.
that she's being recognized for all of it.
Oh yeah, and it's such a great segue into your own master's degree,
Yes.
even if it's a
Yeah.
different topic, just this experience itself.
Yeah.
So
Yeah.
wonderful. Thank you for sharing all that.
Thank you.
So I think I don't see any questions. But thank you again. So I guess we can go on to our next presentation, and our next presenter is Dr. Tim Disher. And Tim, it's been a while since I've seen you. Nice to see you. If you just want to maybe give us a little kind of update of what you're doing and so forth, and then whenever you're ready, you can jump right into the presentation.
Yeah, sure. So it's nice to see some familiar faces and some new faces too. My name's Tim. I am currently with Loon, which is an AI for health economics outcome research services and software company. And my role there is to support primarily services for access to global markets for different drugs. So when a new drug comes on the market and they want to be reimbursed in Canada, I would help support the submission, do the analyses, and support the SLR and everything else, just using our tools. And I'll share my screen quickly. Let's try this. Did that work? Are we seeing my slide deck?
Yes.
Perfect. So the sun is setting here in Spain. I'm just at a conference, and so I have some. I was able to bring some information from the conference into this, which I think will be interesting and hopefully spark some discussion. So I want to focus on AI specifically in systematic literature reviews, and I want to talk about a little bit of history, a lot of hype, and a little bit of some hope for the future that I have. And I'll try to say some provocative things, but nothing too provocative, I hope. So conflict of interest, I'm a partner at Loon. Loon develops software for AI-enabled systematic reviews and provides support for AI-enabled outcomes research. So I am obviously on the pro AI side of the argument. So just keep that in mind. Don't let me convince you of too much, I guess. But so at a high level, this is where we at Loon see where AI fits into the SLR and evidence synthesis. And so some of these bits and pieces are a little bit more specific to the type of HEOR work we're doing. But so first you have kind of the in some ways what's called the lowest hanging fruit, which is the human in the loop for screening for SLRs and targeted literature reviews. And so what we're finding is, at least for RCT screening for effectiveness, right? That's a simple question. It's the easiest place to start. You can achieve expert level sensitivity, specificity, and what I would say is superhuman decision documentation. So the rationale for why they think the AI thinks something should be in or out, and the confidence around that is something that you just don't get when you're having two humans doing a screening. There's just not enough time. The next kind of area is the data extraction from text, figures, and tables. So this is, in large reviews, the most labor-intensive process. So it's really focused on accelerating timelines. I think, again, here, there's a piece where, in some ways, in the right environment, I think it can actually be a little bit better than what I would get from more junior staff in terms of like consistency and accuracy. In some cases, it can also be worse, though, right? So that's the knowing those cases is the hard part. We use it in this. So before we do a meta-analysis, we call it in kind of in the industry meta-analysis feasibility assessment. So this is where you're looking at the key components of variability in your exclusion criteria, your outcomes, missing data handling rules, what the actual analytic models were, et cetera. And you make a decision about whether these studies are similar enough to combine in a synthesis. And so this is a really interesting area, I think, because a lot of it is just things that live in experience. So it's not necessarily stuff that you're going to find written down as opposed to how to do this sort of thing. So by putting that information from someone who's kind of had multiple years of experience in the field and has done hundreds or thousands of these, we think that we can get to something where you're getting a really strong, consistent application of this process. Evidence synthesis, of course, is a kind of a frontier for us. So this is, you're actually now making a decision about what type of data is this, what type of model based on the feasibility assessment would be appropriate to do the synthesis. Then use tools to conduct that synthesis, create figures, interpret them, and move through that whole process. And then lastly is just assisting with the knowledge translation piece, so ensuring consistency with reporting standards, so you can have an AI that's essentially a guardrail to make sure that you are adhering to the relevant standard for reporting, and assisting you with those pieces, with filling in your Prisma table and those types of things, assisting with the initial evidence summary, like for summaries of tables and figures. It's quite good at that sort of stuff as well. So that's where we're thinking a lot. Now, in systematic literature reviews, this is generally at a super high level where things have come and where they're going. So I kind of imagine things as kind of the pre-large language model world. So machine learning, which is where you use essentially like some traditional natural language programming type methods to, as humans are screening, they say something's in, out, and then in the background, with every abstract that's screened, you're retraining a machine learning model that is predicting from the text whether a record should be included or excluded. This is, if you've ever worked with Distiller SR, I think they call their version Daisy. There's a company, Nested Knowledge, that their version is Robot Reviewer, and then there's a program, AS Review, that's open source that all does this. It's adaptive learning. Then we have the first generation large language model implementations. So these were people using chat interface generally for GPT-3, 3.5, and trying to do screening and extraction. And there was, like, it was pretty good. I say there's somewhat improved generalizability in the sense that you could specify a PICOs and it would do like okay at making a decision, as opposed to you having to screen a bunch first. The second generation applications with kind of the larger models and now getting into more prompt engineering, more really thinking carefully about how you should ask a question and what sort of context you should provide the model for making that decision. We started to see accuracy approaching human levels for well-suited tasks. So for, again, RCT screening with a clear question, qualitative, systematic review, scoping review, observational. The questions, if the questions are getting more difficult, if they be more challenging for a human, they become more challenging for the AI still. And then the state of the art right now is using AI agents, which is just a way of thinking of like making almost like a research team that is discussing the evidence, that have their own biases and their own way of approaching things, and having them come to a consensus about whether something should be included or included and how we go through that. And so this is where we're seeing some evidence and validation studies from us and other companies of like human, or in some cases superhuman accuracy, right? So you have essentially one machine that's getting to the level of a 2 human or 3 human expert very experienced team doing a full process for review, which is like quite impressive at the end of the day. So that all sounds amazing. It sounds great. Like it's faster. It's in some cases it might be better. In a lot of cases it's just as good. In probably all cases it's helpful in some way. So why is no one using them? So when we're looking at literature reviews in the space, and there's a poster here at the ISFOR, where someone had done a review of SLR tools for AI and found that essentially most of the publications were just validating them, not actually using them to do the work, right? So something is a bit of a break in that chain. So I think this comes down to, in my opinion, these are the three biggest things, and then really it's the trust. The first one is the most important. So I think there's a trust issue. So if you go to the literature, you're going to see contradicting publications, and often they contradict in a way that makes it seem that I think that really harms trust, which is that the people making and selling the tools all seem to be having a great time, and then the independent investigators seem to be struggling. And so that could be a skill thing, or it could be a bias thing, right? And I think a lot of people are leaning towards the latter. I don't think the validation is good from a research design perspective in a lot of cases, a lot of case studies like one-offs. A lot of the tools available right now aren't really generalizable, so it's just like they show you how to set up the code and do it yourself, but not many people are actually keen to do that or able to do that. And then I think a lot of people only ever talk about economics and speed. And in my opinion, so the economics piece, I'm not sure it applies so much in the research world. It's a big deal in some cases in the industry side, because these projects are very expensive for sponsors. But the speed piece is, if I finish it in say 2 weeks, or I finish it in 6 months, and my submission is a year from now, those are the same results at the end of the day. And so people are willing to wait to be sure that they're not going to get egg on their face if they have any hesitations about the technology, I think. So I talk a little bit more about the trust piece and some of the contradictions. So, on the left, we have this preprint on arXiv that was so confident, essentially, about AI's readiness for use that they conducted the entire literature review on AI's readiness for use and wrote the entire paper with an AI. So the whole thing, it's a standalone research project that was all done by an AI. They found generally high, I would say, but variable outcomes for like accuracy for data extraction and screening. And then we have another article from an academic group where the conclusions that they're saying is that the only case where GPT-4's accuracy rivaled human-like levels was when screening full text in an imbalanced literature dataset using highly reliable prompts. And so reading between the lines, what they're saying is that you have to have essentially tuned it to be so good that it can work specifically for this task, that at that point, like, is there actually value in it? And so they found issues, again, with title abstract and data extraction screening as well. And we have on the left, we have this was a snip from an ISFOR issues panel by a really strong team. But this is a case study, right? So they said, they use this claim. On the left, you have GPT-4 doing a risk of bias 2 assessment, and then you have the human reviewer on the right. And so there are some disagreements, but generally they're like pretty good in a lot of cases. There's some misses, but it would be a good starting point potentially, and certainly if you had the information, right? But then we have this preprint coming through medRxiv that looked at 34 systematic reviews with 157 trials. And they found the agreement between ChatGPT and the systematic review to be, the review authors for overall risk of bias to be 0.16 or 0.17, which is like very bad. It's worse than useless in a way, because you then introduce the risk that someone's not going to do a good job of actually looking through it. So what is it? Is it really good, or is it totally unusable? And this creates an issue for trust, I think. We have on the writing side this paper that found that the chatbots can write abstracts for submissions that are difficult to differentiate from like expert surgeon reviews, right? But then on the right, we have this issue with this person, and this is not this one in particular is not, it's not peer reviewed. It's not even a study or a preprint. It's just someone's blog, but it became so influential that this actually drove up. I used to be at a company, Versana. This came all the way up to me when I was doing the head of AI stuff, and I was told to kind of justify why I was telling everyone that AI is good at summarizing, when this person's saying, well, it doesn't actually summarize, it shortens it. And they had this really good example of what was going wrong. And so an abstract is, in some senses, a way of summarizing a larger document in a structured way. So if it's not good at that, as this person's claiming and showing us some examples, then what is it? Again, is it just that the example on the right was done by someone with poor experience, who's not using like a good prompt, which I do think is the case in this case? Or is it that the team on the left had like a less rigorous way of looking at things, or they got lucky, or they were biased in some way, right? These last two things I want to talk about, and I think they talk about trust in a different way. So these are a couple papers from Harvard Business School and the Wharton School of Business at UPenn, where they talk about this idea on the left, example here, of this jagged frontier of AI. And so what this is talking about, when he says a jagged frontier, it's like, so you're doing a task with AI and it's doing amazing. You do another task, it's doing amazing. And then you do something that seems even easier than both those, but somehow the AI fails. And so that's what they're talking about with like when they say the jagged frontier, they mean it's hard to know like when you're getting to the edge of the abilities for any given task, right? So in this case, this was a study where they created these conditions where they thought they could essentially get people to fall off the cliff of this frontier in a way. And they had human consultants that were using AI to help them answer a question. And when they used the AI, they actually did worse for these types of questions. So it actually made them dumber in a way. You could think of it that way. We've seen something similar making the rounds with physicians. Sometimes physicians using AI can be worse than the AI alone or physicians alone for like diagnostic vignettes, right? Which is like a small thing, but there's also this other piece that the models that are getting larger. So if you've been in the space and you've been like using like GPT-2, like the Da Vinci models, and then they did 3 and 3.5 and 4, there used to be more guardrails on the smaller models. So what would happen was you would ask it to do something and it would decline. It would say it can't do that. Or it would be like, it would give you a lot of warning that this is something that is not really meant to do. Whereas now a lot of the larger models, in response, I think, to customers not liking being told no, have taken a lot of those guardrails off. And so now AI will confidently do things that it just isn't good at. And so if you don't know that, you don't have that experience, you can get tricked really easily. And so I think this is a way that I think hearing this can damage some trust, but I also think this is the way that I've seen a lot of people change their opinions about whether or not these large language models can be useful for them for their projects. They'll do something and they'll say, well, it gave me this crazy response. And you talk through and figure what they're doing. And if you're experienced, in a lot of these cases, you can say, oh yeah, this is like one of these things. We know that it's not good at this type of question, right? I saw someone on Twitter once say that they know that AI can't help them with systematic literature reviews, and here's their proof. And they showed some chats where they said, do a systematic literature review on these PICOs, and then just expected ChatGPT itself to be able to go do this whole process instead of actually breaking it down and giving it tools and doing these other things, right? So for me, the key takeaways for building trust is that you need this domain expertise. So knowing how to set up the what sort of data do you send? How do you send it? What's the context that you provide? You provide a lot of context or a little bit. How do you actually structure the prompt, like what you're asking for? Is all things that are really domain expertise, right? So we need that. That's why we need humans in the loop a lot of the time. I think also when we look at the jagged frontier, we look at the piece of the models growing larger and being less stable in some ways. It points to needing ongoing validation. So at Loon, we used several different models and several different versions of the models, and they all have different personalities in a way, and those can change over time, and their performance can change over time. So a prompt that worked well for Claude isn't necessarily always going to be something that works really well on GPT-4o, right? So the validation is not a point in time. It has to keep on going. I think providers like Loon, like myself, just need to be honest. If I validate, like, so our screener, we have a preprint that's under review now. That's validated for RCTs, and it does really well. But I can't, in good conscience, tell you that that means you're going to get those same results when you go with like a complex question on like non-randomized studies or on qualitative evidence or something else, right? Because we haven't done that validation. For data extraction, a lot of the data extraction papers that have done really well, you read them and you're like, this is amazing. It's 100% accuracy. But what they're really doing is just like taking like a hazard ratio or an odds ratio or relative risk or something, and its confidence interval from an abstract. And that is like the easiest task. What's a much harder task? Extracting things from figures, extracting data from tables, especially complex tables, extracting things from very large documents. Those are all much harder, right? And so if you think this is going to be amazing because you saw it's 100% accurate, and then you go and you start trying to extract things from like an HTA report or details that are in tables or really complex things like, so continuous outcomes, if you do meta-analysis, you can report them in more than 20 different ways. And you probably only want one of them for your review, right? And so you have to make sure it picks the right one. And then lastly, I think it kind of just points to this idea. So this is something that I'm working on a lot here at Loon, which is guardrails. So this is where you're kind of bringing in a mix of information. So you have identifying some surprising or outlying results with a mix of AI and some traditional models, right? So we have some confidence scoring and some models around that predict kind of those records that a human really should rescreen. Excuse me. Bringing that decision logic up only when you need it instead of just kind of overwhelming people so they don't just skim. And then we are trying to have tools that essentially you give a research question, and then based on what we know in our experience with the tool itself and what we know from our experience having done many reviews, we do an assessment of like, is this PICOs actually likely to succeed? Or should the user be encouraged to change it in some way, maybe to add additional exclusion criteria, maybe something about the outcome is vague, and try and touch on those things to help people have as much success as possible. So I assume everybody is familiar with some version of this figure. So this is the hype cycle. where you have this initial technology trigger. Everybody gets so excited, they think this is going to change the world. Then they actually start using it for difficult problems, and they think actually this is garbage, and then slowly come up to something a little bit better, right? So I've gone through this. I put myself maybe here. So I'd say I'm pretty excited, but a lot less maybe than I was when I was a little bit delusional up on this piece of it. And I think an important thing to think about is a lot of the people that I talk to on the tech side are all like in somewhere on this area. We've all gone through this piece, but a lot of our clients, and I think a lot of people that that are maybe in the room, if you haven't been using the tools a lot, you're going to start down here and have this experience, right? And so I think we need to find a way to guide people through that, and maybe have something that's more just like a nice curved line through here, right? So these are just some common things I've seen at this conference and others. So I mentioned this one before. So for data extraction specifically, this is an area that people are focusing on a lot. And so you can have poor performance on hard elements that can be hidden by good performance on really easy to get elements. So they extract 1,000 things from the study, of which like 900 are very easy to extract because they're unambiguous. And then you hide a small number of areas where you have like a lot of mistakes. But those are actually the ones that are the most important from a research perspective. There's a little bit of spin. I've seen this one before. So a poster that was saying, oh, we achieved 100% accuracy, but then like later in the poster, it's like, well, there's some cases where we get hallucinations and errors, and where like it makes up models, and these are those cases. So it's not really 100% accurate. It's 100% accurate in the ideal sample, which I think is an important distinction. And then I'll just finish on just a quick little summary of some of the things that I was seeing here to see if like this matches any the experience of the people here today. So at this conference, there was 56 AI applications to SLRs. About 30 of them were focused on validation of extraction tools specifically. None of them were applications of actually doing reviews with AI. It was all just people validating their tools. So we continue to see that gap on the actual application side. This is a slide actually made before the conference, and then it has like really materialized. So I found 20 abstracts that were here that were essentially negative or reserved, like it just didn't do well. The tool was not like great, so there was a real need for human oversight. And then we said, and then there was another 30 abstracts that said like, we're ready right now, this is potentially transformative, you could be doing all of your reviews in a day. And then like a little bit of a token statement of emphasis for human oversight. And then that's kind of what's been happening in the actual presentations as well. So a lot of the oral presentations here have been much more reserved and not very impressive. But then a lot of the people who are in some ways like really pushing the field forward, if you're talking with them or meeting them throughout the conference, they're kind of more in this, we need to be pushing this forward even faster than we are phase. So it depends who you talk to at this conference. We're either there or we're 5 years away. And then just some interesting overall trends that I think is matched in the literature as well. So interestingly, a lot of people do title and abstract screening and data extraction, but not many people are talking about full text screening. And I think part of that could be that full text screening is more expensive in terms of getting the full text and the actual tokens. But it assumes that if you have a good title and abstract screener, you must do better on full text because there's more text. How could you? It's much more clear. But the problem is what we found is the full text, if you're not being smart about it, can actually be really difficult to get right. because when you have all of that noise, it can be a little bit harder in some cases to actually extract the right information. You can start pulling things from the discussion section or stuff like that. There's still some people that have been interested in the machine learning stuff, the pre-LLM tools, which I found a little bit surprising. There was some early evidence that once you get outside of RCTs, it doesn't work so well on the precision side anyways. So a lot of false positives, articles that you will not ultimately include coming through. And then this one was my favorite one, which is that the data extraction variability was anywhere from like less than 50% to greater than 95% accuracy across posters, which I don't think inspires confidence. But again, I think that's because there's difficulty in the components being extracted, difficulty in the question, the skill of the actual people that are employing it. And these are all case study validations. So it's difficult to really draw some conclusions from them. So a little bit of talk of some of the work that we've been doing at Loon. So this is kind of our hope for the future. So this is our agent-based title abstract screening. Preprint, we did essentially a replication of 7 CADITH, or now known as CDA, reviews, and had very high sensitivity. So we captured 98.95% of the articles that should have gone through, according to humans, and like good specificity. And I say good tentatively because it sounds high, 95%, but when the overall inclusion rate is 7%, it means that out of 5,000 abstracts, you would retrieve 222 full texts that you'd ultimately exclude, which is a lot of work and can get expensive depending on how you're getting them. We have to pay for ours. We found also, so this is one that I finished just before this conference that I found really interesting. So we have our AI confidence essentially for every decision. And we found that you can use this to find the 5% of articles that were responsible for 60% of the errors. So you get your sensitivity from 95 up to 98.1, which drops that 222 down to 88, which is better and really good, but it would be nice if we could get to 100. So last couple slides. Over 20 years, it took 20 years of classic machine learning applications in this space. And then we passed through the next 3 generations of tools in like 2 years. So we went from first generation LLM, second generation, now we're in agents and kind of going beyond. I think a lot of early adopters have gone through the hype cycle, but now we're getting people who are not in that group that are kind of at the peak. And so I think there could be a lot of people that jump into the space, get disappointed, and get soured on it for a while. So you have to find a way to help avoid that. And then hope. So I think true, fully AI systematic literature reviews aren't here yet, but AI-enabled reviews seem to be safe, and they can increase efficiency and potentially quality. And it's the potentially quality piece that I'm actually more interested in. And then one self-promo, just to say that we are doing some for academic and patient groups, if you're aware of any. We're doing 3 free projects with like analysis support and everything else through this Loon course. So if you send me an email at that email, we can get you set up, hopefully, and see if it works in some other applications. And that's it.
Very interesting, Tim. I'm sure you're going to have some questions, but I can start. So one of the issues, and I'm speaking to this from a faculty member, is AI is problematic with students using it to write term papers and so forth. And so there's that sort of integrity issue around that. So I don't know how that looks like in this sense, because these are, from what the examples you've used, I don't think they're student papers or projects. So, I guess I'm trying to think about how will this look like, say, when it is more evolved and there is that more certainty around AI doing reviews. Because I mean, some of our master's students, for example, do reviews as their thesis. So will it can someone have potentially an AI generated thesis? And so that I always think about that. And then from outside from the learning situation, how does an AI generated review, for example, like how does that sit from intellectual property perspective? Because is it the person that said or developed? Because I don't know all the programming that goes behind what you do. You know, I'm in my head, I'm thinking, do you just go to chat or the chat GT and say, make me a review, like just, on the speaker. I'm sure there's more than that. But, and so is that the person who says that is that intellectual property belongs to? So I'm curious, like how, because that can be a problem for academia. So I guess it's kind of two questions. The one is from a student perspective, how could that look like? And then the sort of intellectual property question. And I'll stop
Okay,
there.
great.
Thanks.
Awesome, thanks. So I'm not sure I have answers to both of those, but I do have
Well,
an
even
answer.
thoughts around
Yeah.
it.
Yeah, so I'd say for the students, I think we need to think of two things. So one is like, if this is where things are going, then how do you structure a program in a way that you're teaching the tools that are relevant while still allowing people to get the experience and the knowledge of like everything that the tool is doing for them, right? Similar to like linear regression, right? Like I was never solving matrices by hand in my PhD, right? So like a lot of things were being done for me in that sense, like on the analysis side. But I do feel like my first reaction is that it's important to learn the process. You can't build the domain expertise by having something else do it for you. So I think in the short term, at least, that I would not really be keen on a AI systematic review for a master's project, unless there was something cool and novel about it that they did. And then for the IP piece, that's a space that I just don't know anything about, unfortunately. The sense as at the moment is that it's still like New England Journal of Medicine is encouraging people to use ChatGPT to help them with their copy editing, so they can write higher quality. We can have people that are not English first language still being able to write high quality papers. So I think as of right now, the feeling is that the IP still belongs to the researcher. But yeah.
Well, thank you. Very good attempts at answering those. So there's quite a few hands up, so I'll let you, Justine is number one, and then we can just go in order.
Hi, Tim. Nice to hear your presentation and where you landed at the moment. I'm very interested in the work that you're doing, obviously. It shouldn't be a surprise, but I think I have a lot of questions. But my primary question, if you can talk about in terms of cost, in terms of AI, we know that systematic reviews that use like programs such as like Confidence or Distiller cost money, but they really streamline the process. And I anticipate like AI will eventually participate in this, like in a similar way. So what would a cost of like partnering with different AI programs to help run systematic reviews?
So there's a few different things. So if you're talking about like a platform, so there's a few out there. I'll send you an email with some names of different platforms that I'm aware of. They range from like not very expensive to like blindingly expensive. So a lot of the stuff that's focused on industry, right? Like when we used to do like an RCT systematic review at my former company for like a pharmaceutical company for their submission, it would be somewhere between like $150,000 and $200,000 US to have two people do it. So the people that are focusing on that pricing, it's going to be like it's going to be in the sky essentially. For the other option is like if you apply the principles yourself, the coding is like difficult, but not so difficult. And then you're just talking tokens. And so you're probably looking at like maybe 50 or 60 bucks for a review. But so somewhere between 200,000 and $60, I think, Justine.
Sounds good.
Hi, Leah.
Hey, Tim. Nice to see you. Thanks for the presentation. Just kind of going back to Audrey's comment about students using AI. I know in the librarian circles that I'm in, we are like the most skeptical group that is out there, and we are kind of likening it to handing the keys over to someone without a license, without teaching them how to do it, and then they can just drive a car. So I guess I'll start with the comment that I think librarians are going to be some of the biggest gatekeepers in terms of AI, and I would encourage companies like Loon to just kind of maintain those relationships with the librarian community, because they're going to be the people who ultimately will help to share these tools with users, right? And so in that vein, a lot of librarians are like, how do we keep up with all this innovation that's happening? And I don't know if you have any pointers on, like where you go to keep up with all this stuff that's happening in the AI sphere.
Yeah, it's hard. It's like every 6 months, there's like a huge step change, and it's like something that you couldn't do before, you can do now. I'd say librarians, I do want to make the comment, librarians are rightfully skeptical about the ability of AIs to create searches. It's not been great. What I've seen is definitely not at the level of anything I would expect from a librarian. So it's really more of like a student sort of simple search, right? So I think there's areas where there's a lot of skepticism that's warranted, and that's one of them. In terms of keeping up, unfortunately, the way that I keep up is that like I'm competing with everybody else in the space right now. So I see all their stuff and I hear things from clients, and our CEO guide is like very much in the research space. So he's like on archive and Met Archive all the time, looking for new things coming up. So I don't have like a newsletter or like something like that would be good, other than just to like do a periodic search. But
cool.
Just like, I guess the main message is just because something wasn't possible 6 months ago doesn't mean it's not possible now.
Right. Okay, thanks, Tim.
Yeah, thank you.
I think I'm next. Hey, Tim.
Hey, Elena.
Thanks for the presentation. Yeah, so I guess my question is really similar to Justine's. So when in some of your first, I think it was maybe your first few slides about data extraction for AI or with using AI. So, and I'm sure Leah would have some thoughts around this too. So we used Covidence usually we would use Excel for data extraction. And then more recently we started using Covidence, and like, it's fine, but it's actually like really time consuming. Mm-hmm. So, if you could even just carve out, like, if you had a big enough team, it would be great to do it all, like title and abstract, full text, and data extraction. Yeah. But if you had to carve it out, I think that it would be the most beneficial to use it for data extraction. So how do academic research teams that don't have very much funding, if any, how do those teams, where do you go to find these tools? I guess I'm wondering sort of the same as Justine. Like, do you go to companies like you guys? Where do you go?
So we're the only company, like, I guess, like outward facing software company that I think you could really purchase like a data extraction tool that's probably at the level you're looking for. Like Distiller is doing some new stuff, but it's really simple. It's not extracting kind of like everything, and so is Nested Knowledge, and I think the rest are just people using tools internally. Mm-hmm. So I think for data extraction at the moment, it's just us that would do like a full, like, into a common data model. And then for us, it's only RCTs that we're doing that for, or clinical trials or comparative studies, right? Okay. So it'll depend on the type of study, but but we could definitely talk.
Yeah.
And like that sort of thing would be like a good fit for like that course program, right? So we're doing those 3 projects a year for free, essentially.
Oh, okay, yeah.
Yeah.
So then in terms of so it's really just for RCTs. So there isn't, so there's, this space is growing, or what's your feeling on that?
Yeah, it's just the reason is that the validation takes a long time
Right.
to feel confident in the technology, and RCTs are the easiest space. So we're kind of assuming if we can't get it perfect there, then going to a much more unclear type of data extraction will be even worse. So that's just kind of where we are at the moment.
Okay.
That's
But
where
again, it
pretty
could
much
change
everyone in the space is. Yeah, it could change in 6 months. Yeah.
Okay, great. Thanks so much, Tim.
Okay, thank you.
Hey, we have time for one more. So Ashton.
Hey, Tim. Great presentation. It was really informative. I appreciate that. So my question is more about the process itself. My lab's really interested in human AI teams and trust dynamics and things like that. But I'm interested about the literature review because you kind of highlight that it's a human in the loop literature review. So obviously, I assume I've never done one with AI, but I assume AI is doing the bulk load of the work. But what is the human's role in the process when it comes to, the abstract review, the full text review? Is the human more of a supervisor? Do they have a veto role over the AI, or is it really just more of a monitoring thing?
So we do it in one of 2 ways, essentially. It's either a human is just reviewing the decisions made by the AI and the rationale given by the AI. So you essentially have a platform where you're looking at the AI's decision, include, exclude, the abstract, and the rationale for why it made that decision, and then the human's just deciding whether they agree or not. Or you could do the human does everything on their own, the AI does everything on their own, and then you bring it together and look at the conflicts and resolve them like you would in like a normal process. You're essentially replacing one person with an AI at that point. Does that make sense? Does that answer your question?
Yes, that makes perfect sense. Thank you.
Okay, perfect. Thanks. All
Well,
right,
thank you
great.
so much, Tim. That was an excellent presentation. Very nice to see you. Very jealous you're in
Yeah, nice to see
Spain,
you.
but somebody's got
The
to
sun
do
is
it.
setting here.
Yeah.
Yes.
Thanks again, and we look forward to hearing more. Very
Yeah.
good, excellent work. Thank you so much.
Yeah, thank you very much. It's nice to see you.
Okay.
Thank you for the questions. Bye-bye.
Bye-bye. Bye.